Hi, everybody. It's Dr. Laura with Connect My Brain. So glad that you are tuning in for another exciting episode of what's going on in development and how does this affect your children, your family, yourself. And by all means, please share this information. I recently listened to a podcast that was very focused on medications for ADHD. And many things that were said regarding the medications was funneled into this idea that it's okay that all of our kids are on these medications because what they're really doing is they're creating neuroplasticity. Okay, so let's kind of break that word down just a bit. Neuroplasticity is something, it can be a positive or a negative, but it's when you go to work on something and you are pulling things together, body and brain. And I use the words quite often, fire together, wire together. You can make changes from a current state. So it can be good or bad. So let's say that I go on this fast food binge and I eat McDonald's or Burger King every single day of my life, every meal. And I do this for a long period of time. My health will absolutely be impacted. And the way that the systems in my body would be impacted are going to create a different feedback message. And it's going to be the body going to the brain and the brain going to the body. So anything that we do absolutely can have a long-standing change on human physiology. So using ADHD medications, which the majority of them are stimulant medications, meaning kind of like throwing the gas pedal on something, will also have an effect on the cardiovascular system, the digestive system, the immune system, and ultimately the brain, because the medications do pass the blood-brain barrier. Obviously, its goal is to be able to improve attention and focus. So as I always try to make a stance in these podcasts, there is no judgment about what anybody is choosing to do. And there is a likelihood that in many cases, you've actually seen your child is able to focus better, or as an adult with ADHD, you're able to focus better. But what goes on in childhood is different than what goes on in adulthood. This is a brain that's still open to development. And so what we're putting in absolutely can have long-standing changes to that individual's brain. But what really kind of stirred me in this podcast was that this concept of neuroplasticity was sounding like a very good thing, that we're making the circuits that wire together, fire together, wire together for focus and attention are being changed based on a chemical component and having a neuroplastic change. However, when the next question came up, do I have to stay on them forever? If it was a true neuroplastic change, why do you have to stay on them? If it's making a change, why aren't you able to keep the change? Why do you have to modulate the change long-standing from childhood to adult life and beyond? So it really got me thinking, as well as I have to say, probably the majority of the patients that come to see me are here for some kind of attention issue. And lately, more and more parents are, well, yeah, my kid has ADHD, doesn't every kid? Wow, we've got to stop normalizing these things that are showing up in our pediatric population as though they are normal, because they're not. You should absolutely be able to go through development and acquire attention. So, in this podcast and the next one, I'm going to really focus on ADHD. I want to give you some history about what's behind ADHD diagnosis. And then in the next one, I'm going to highlight the medications that are used and how the areas that they're targeting, what how do they develop, and help you begin to think about what was going on for your child during these very important developmental years. My focus in practice is development. When I learn something, I always think, well, what came before that? What came before that? What came before that? And I recently just wrote an article for my colleagues describing the same thing. Everything that we are able to do function wise went through a developmental sequence. It in trying to do some searches and get some up-to-date information about what other people are actually hearing. First of all, I find it very interesting over the last few years how narrow internet searches have really become, and they're very focused on the pharmaceutical end and pretty much just indicating that that's the only thing we ever need to think about. And it is not a lack of Vyvanse. It is not a lack of Concerta that is keeping your child or yourself from paying attention. So I hope this information, one, will give you a very interesting history perspective. And then in the next one, we're going to connect the dots back to development so that you can begin to see this sequence that I'm referring to. So the first thing is that ADHD around 1960, and that in and of itself is a very interesting time of medical history because lots of medications came out. And I still see this in articles that I'm reading, is that it seems like this is the only thing that you could possibly think of. But in the 1960s, they came out with a lot of the psychotropic medications that are available today. And therefore, people going in saying, I'm depressed, I'm anxious, whatever, there immediately was a prescription given. And no offense and no judgment, you might be taking something for depression and or anxiety, and it's really working for you, and that's terrific. But it's always about the long-term impact and what's causing the anxiety, what's causing the depression, what's causing the lack of attention. And if there is a path to follow in order to resolve, I would think that that's a good thing, especially because one of the things that came out in a terrific book I mentioned before called ADHD Nation, it was really identifying some other history that the longer people are on ADHD medication, one of the things that they're actually finding is that it is impacting memory. And I am talking to young people in their 20s and 30s, and that is one of their chief complaints. And many of them have a history of taking ADHD medication. Okay. Possibility, correlation. So in 1960, ADHD, back then it was called the hyperkinetic child, was actually declared a mental disorder, a neurodevelopmental disorder. Well, that really just alarmed me that we would automatically be putting all these children or individuals into this category of having a mental disorder. Now, again, I'm only going to say this one time, but there's honestly, there's no judgment. I think that all fields of healthcare are important. I feel like even in my own profession, there's many things that need to be evaluated and cleaned up. But I think it exists everywhere. I don't think it's limited to just one area. Recently, having gone through, my mother had a medical emergency, and our healthcare system is truly broken, and that is my opinion. But to put all these kids into a classification of mental disorder, you have to understand when that label gets placed on your child, the only way that it can be removed is it has to be a person of equal standing coming in and evaluating your child for the very same thing. And there are literally careers out there that you cannot have a mental disorder in your health history in order to participate. So keep that in mind. Most of the time, I think parents really run for the label because it entitles them to services. So keep that in mind as we kind of go through this timeline. The other interesting thing that I want to kind of compare this to, did you have any idea that pregnancy is actually considered a disease? And these are things that come in this diagnosis manual that all medical providers use. And this is a way for them to be able to code, give it numbers, and then process it to your insurance. If it's not a disease, if it's not a disorder that falls within these categories, that's where you're running into blockage from insurance. And you're going to see this in your timeline that we're going to talk about today. So let's define neurodevelopment, okay? I talk about neurodevelopment all the time because you go through neurodevelopment. You come into this world, you're fully formed, but you're not fully functioning. And you have things that happen in the womb, things that happen out here, and they literally are building the brain, the neurological base, and you're going through a developmental window. Remember what I have discussed with you many times is that the beginning of this year, the CDC actually reframed all the developmental milestones, making it to where the children are doing things later and later. Okay, we've already seen a massive incline in ADHD diagnoses or ADD diagnoses. From now on, I'm just going to say attention diagnoses because there's many of them. So the longer that we let kids just keep going developmentally without accomplishing very basic movement sequences, it changes how the brain is going to work. And crawling is not even included in the CDC's new framework. Crawling is on your belly, creeping is on hands and knees. And again, we've talked about this before, but just in case you're coming in, you have all this development that goes on in each side of the brain. So there's function on the left, there's function on the right. It isn't until you start going through crawling and creeping that you begin to share this information on both sides, which allows you to do things. So here I am, I'm talking to you, and I have to make sense to you. So both sides of my brain are working right now to communicate this message. So, as I said before, ADHD was called the hyperkinetic child. It wasn't until 1960s that the American Psychiatric Association formally recognized it as a mental disorder. And in the 1980s, the diagnosis became known as attention deficit disorder. 1960, virtually every major psychiatry position in the US was occupied by a psychoanalyst. More than half of all psychiatrists were trained to become analysts or were analytically inclined in their orientation. All of the major psychiatry departments appointed psychoanalysts as chairmen. Psychoanalysts had become a lucrative, high prestige sub-discipline of psychiatry, attracting the best and brightest minds from American medical schools. The future looked bright and the opportunities seemed endless. The psychoanalyst of this era was a conservative and elite discipline. Psychoanalysts, this method of psychological therapy was originated by Sigmund Freud, in which free association, dream interpretation, and analysis of resistance and transference are used to explore repressed or unconscious impulses, anxieties, and internal conflicts in order to free psychic energy for mature love and work. But within 20 years, okay, 1960, 1980, very interesting time. But within 20 years, all of this had changed. Psychoanalysts was regulated to a second-class position in psychiatry. And the hope and excitement that marked psychiatry's relationship to psychoanalysts in the 1950s and 60s had been replaced by doubt, criticism, and in some cases, outright hostility. By the 1960s, psychoanalysts began to be applied to problems other than mental disorders, with analysts offering solutions to a whole host of social ills such as racism, poverty, and war. So that was the beginning, and then there was a great shift. And then what are we going to do with this information? What are we going to do with all these people? Keep this in mind. In 1970 was the birth of psychopharmacology, and all of these medications that I am talking about, they fall into this category. The 1980s were marked by the growth of managed care, insurance company involvement in healthcare decision-making, and the standardization of psychotherapy into easily studied treatment protocols and manuals. This focus on cost cutting and standardization led to the dissemination of briefer and more symptom-focused therapies, such as cognitive behavioral therapy and related approaches. Meanwhile, psychoanalysts had little interest in researching or standardizing these approaches. They knew it worked, and the private nature of the psychoanalytical relationship did not render it amenable to traditional research methods. As a result, psychoanalysts fell victim to the broader social trends and what little influence it could continue to have on American psychiatry gave way to short-term therapies and the development of the first SSRI drugs in the late 1980s. SSRIs are serotonin reuptake inhibitors. What was once a powerful and well-respected subspecialty of psychiatry, psychoanalysis was largely abandoned by medicine by the 1980s and 1990s. This is a very interesting part in many different healthcare disciplines. If you don't follow how you're being directed, you're not included. This is one of the main things that happened to chiropractic. Chiropractic did not want to join medical forces. They wanted to stay an independent industry. And the main reason was it allowed us as chiropractors to become a direct portal of entry for an individual to come to us without a referral. That's how the system works. Meanwhile, you've got an insurance industry that has now regulated all the steps an individual gets to have when they're using their insurance and in the medical model. You have people that look at insurance policies only to make that decision. And I really do understand this very big picture of things. But when it comes to your health, you have to at least know how the system works so that you can begin to make that educated decision and decide, where do I go and what steps am I really going to take to get there? And I know it's hard because you pay a lot of money for your insurance premium. Sometimes you don't really get to make that decision about what is really covered. If you're getting a policy through your work, you sometimes just get what you get. But you have to understand it's the policy that you have that was regulating what you get to receive when you're depending on that in making your healthcare choices. ADHD was first mentioned in 1902 by the British pediatrician Sir George Frederick Still, an abnormal defect of moral control in children. He found that some affected children could not control their behavior the way a typical child would, but they were still intelligent. The APA issued the first diagnostic and statistical manual of mental disorders. This is what is known as the DSM. They created the first one in 1952 for mental disorders. The manual listed all of the recognized mental disorders. It also included known causes, risk factors, and treatment for each condition. Doctors are still using an updated version of this today. The APA did not recognize ADHD in their first edition. A second DSM was published in 1968. The edition included hyperkinetic reaction of childhood for the first time. The FDA approved the psychostimulant Ritalin, which is also methylphenidate, in 1955. It became more popular as ADHD treatment as the disorder became better understood and the diagnoses increased. The medication is still used to treat ADHD today. Moving on. Concerta is a popular medication today, but it is Ritalin. And you need to get some real backbone to Ritalin. Ritalin was actually the two boys that broke into Columbine High School back in 1999. Literally went in there and went into the nurse's room and took all the medications that were in there, and they were all the medications prescribed as Ritalin. It is considered a Schedule II substance, so is Concerta. Schedule I drugs have a high potential for abuse and the potential to create psychological and or physical dependence. As the drug schedule changes, Schedule 2 and Schedule 3 also demonstrate abuse potential. You can actually look this up yourself. It is under drug scheduling, which is from the the United States Drug Enforcement Administration. You can literally look that up yourself, and it will give you what the different schedulings mean. But the big picture idea is that if there is the potential for abuse or any type of psychological event, especially withdrawing from these substances, they must be listed as a Schedule 1, 2, or 3, etc. So this is important because years ago, Ritalin was the drug of choice for ADHD. It got a black label put on it, which means that it can lead to suicide. And there was a congressional hearing where all these parents showed up because the insurance company was going to stop paying for it. And the parents were pleading to the to the Congress that this needed to be revised because these drugs were recommended to their children, and now their children were being forced to withdraw from it, and they were not okay. And some children had even committed suicide. And unfortunately, we are seeing quite a bit of this today, not necessarily only related to Ritalin, but it is happening. The APA released a third edition of the DSM, the manual. They changed the name of the disorder from hyperkinetic reaction of childhood to attention deficit disorder. Scientists believe hyperactivity was not a common symptom of this disorder. Methylphenidate, Concerta, Ritalin exhibit various impacts on an individual. Ritalin is widely acknowledged for its potential to enhance concentration among individuals. Furthermore, it facilitates the enhancement of users' concentrations on the given task, thereby governing behavioral tendencies such as impulsivity and contributing to the reinforcement of apt organization and attentiveness. So now, if we look at this on a long-term basis, if things are firing and wiring together, and we take this for a period of time, why do you have to keep going? So what I want to do is try to give this idea of development and attention. There was a very strong correlation from the onset of a wave of enthusiasm in the realm of psychiatry. And then 20 years later, there was a huge shift. Meanwhile, we shifted all of that information into a regulation where if a child can be evaluated for ADD, ADHD, the medications can then just be readily given. Now, there's definitely places that offer nutritional ideas, supplement ideas, but for the most part, what is truly focused on is that ADD, ADHD needs to be governed from over or by the APA. And I would like you to think of another side of the story. Why is this considered a mental illness? Because a child's having trouble paying attention, because a child's hyperactive. So let's look at How do we develop attention so we can see, are we just kind of going in when this child is school age? And because now somebody is saying your child's having trouble with focus and attention, now there's a grade applied. Now there's trouble with control in the classroom. Now there's trouble with the child being able to regulate themselves. Now the child's getting older, and we're talking about maybe somebody preteen or teen, and the stakes are getting a little bit higher. They're not able to finish a grade. Maybe you're very concerned that your young person, they're not going to go to college. I actually heard a parent say, because of the struggles, well, we're not even focused on college. What are we doing to the innate potential of this individual? Are we just giving up? When I get an opportunity to look at them from a developmental model, and you can see so clearly where the wiring and firing is just a complete mismatch, we need to be screening our children. I have tried in so many different ways to reach out to schools. We need to be looking at our children at the very beginning. Even if you have your baby in a hospital setting, our hospital settings, if they know the red flags that say these are possibilities that may lead to developmental delay, you need to seek out someone to guide you through your child's development. Then we need to have those resources. If you have a toddler and your child, you're already going, I don't think my child is on target. Don't wait. We need to be looking at these children when they're very little. That's the easiest time. That's the easiest time to begin to make some changes. I was talking to another mother the other day, and her baby is not sitting up. And what mama was thinking at first, well, my baby is super big and they're just having trouble. No, the size of your baby has been coming along with your baby. So all I had to do is say, let me ask you this. You put your child in this upright seated position, and then does your child just kind of then migrate and lay their little belly to the floor? And they're still smiling. Absolutely. That's exactly what they do. That's low tone. And if we begin to focus on where that child is right now in that open window of development, you can change the trajectory of the way that they're going. And they don't have to be a product of what people have just grown to accept. You have so many milestones that are going to give you insight to your child's development. Over on my website, over by the podcast, you can put your information in, and we're going to send you Dr. Hansen's guide to developmental milestones. They're all not there. I tried to put it in a nice condensed package, but they're there, and there's absolutely no charge. If you want to ask me a question, send me a message through the website, connectmybrain.com. I am happy to help you see if that is where your child should be or if it is not. But there are very specific patterns that are going to fire up and allow your child to do various tasks. And attention is one of them. One podcast, I talked about the Moro reflex. You can go listen to it, share it. The Moro reflex is the beginning of this journey, and it starts 9 weeks in the womb. And the number one thing on there is arousal. Does that baby know how to wake and go to sleep? So we're going to ask that question. We're going to ask it back when your baby was a baby. One of the things that happens in our healthcare model today is we just kind of go at you at the age that you are. And if you're a 12-year-old and somebody goes, well, how's he sleeping? You need to know how it got laid down. There are patterns, wiring and firing. Newborn babies should sleep about 2.5 to 3 hours, and then they should startle and wake up because they need glucose. Keep that word in mind. That is their fuel. If you don't have fuel, you have no brain energy, and that can lead to a host of issues. The visual system is part of attention organization, circuitry. This begins 4 weeks in the womb. Auditory. Auditory begins 5 weeks in the womb. The tactile system. It's before your eyes and your ears. It's part of the whole withdrawal reflex program. That's literally teaching your nervous system how to recognize a potential threat, which could lead to over-aroused. It could also, if it didn't get wired up right, could be an under-aroused. Over-aroused is our ADHD. Under-aroused is just our ADD. You go through developmental sequences to bring the circuitry online. In infancy, specifically around 18 to 24 months, this is when the sensory system is just exploding. Now, before that is what's called the central pattern generators. These are the reflexes. There's a host of podcasts on the primitive reflexes. This is a very important part about how the nervous system gets wired up. And just because it started in the womb doesn't mean that you ignore it today. One day I was talking to an adult and I really wanted her to include, let's work on your withdrawal reflexes because they're very high. And I truly believe that neurofeedback is a great therapy, but it is not a standalone therapy. In fact, we're getting ready to publish our book the end of June that I was able to contribute a chapter to. And it's the introduction to QEEG. And the chapter that I contributed is all about the developmental journey. And I was asked to do this because neurofeedback is not meant to be a standalone therapy. You don't just go in and work on the circuitry. You got a body. And the body had a program. Did the program come together as it was expected to do? And sometimes with these little people, I don't want them to start neurofeedback until we have a chance to get their body firing the way that it's supposed to. So the circuitry from the top down, from the bottom up, is firing and wiring together like it's supposed to. So central pattern generators are followed by the sensory motor system. All these kids out here getting a sensory motor diagnosis or sensory motor problem diagnosis, there's stuff before that. It's a progression. They start to also look at object permanence, which means that if I cover up a toy, they actually know it's still there. And it's part of voluntary attention. And as we are moving through infancy, toddler, they're gaining the ability to pay attention for about 20 minutes. Then we move to 5 and up. This, these periods of time, it's also when the subconscious is growing and forming. And these different stages, they all are being identified up until around 7.5 to 8.5. And then that's when the brain changes tremendously. But during the operational stage, between about 2 and 7, so we'll put about 5, it's a symbolic relationship, meaning they're learning how words have multiple meaning, like the word house. When a child says, let's play house, playing house could mean let's go construct the cardboard and make a house. Children learn and when to pay attention during this time. They are focused on themselves. So we go from the environment, mom, the environment, dad, siblings, to now focusing on ourselves. This is when concentration begins to be more stable. During this developmental stage, children also acquire the ability to analyze a situation. They also decide to pay more or less attention depending on their interest in the activity or topic. I keep hearing attention being associated, well, they pay attention as long as they're interested in it. Okay, I think that's the majority of us, but what got wired and fired together during that time? I was out on Mother's Day enjoying breakfast with my daughter, and I feel like a stalker, but I took a picture because I wanted to use it in an article and definitely, fuzzed out the face and all that. But here a family was. This one could not have been above 2. And I see this so much, and I bet you do too. But the little person is sitting in a high chair, has a bottle, sucking on a bottle where the table's actually holding up the bottle. The little one's not even engaged with their hands. And they've got a tablet sitting on the table with a beautiful blue colored frame to give it the house for the device. And that little one is just sitting there staring at the device. Now, at 2, I am supposed to be physically exploring my environment and absorbing information through all of my senses: smell, sight, taste, touch, and sound. And what am I doing? I'm staring at a tablet. Over fixation of gaze. And that will absolutely impede the visual system. And remember what I said above. The attention system is influenced by the visual system. You've got to take some inventory. Don't feel guilty. Don't resonate in that, but do some inventory. What was your child doing during these developmental windows? What were they engaged in that wired and fired their attention and interest and likes? Today, all you see is people's faces down into a screen. Being over at the hospital recently, I can't tell you how many people, adults, almost ran into me because the only place that they're looking is at their phone. You have to check out the book Brainwash. This is not helping any of us. And I know they're here to stay. But you know what? You got to put them down. And more importantly, you got to take them away from your kids. They've got to get back into the engagement of the physical system. As we move into the ages of 7 and 11, this is what's considered concrete operational stage, and they're applying thought to what they see. But again, it's all been influenced by what was brought into those developmental windows. Formal operational stage is teenage to adult years, and this is abstract thinking and problem solving. I promise you, your child and yourself did not come into this world with a lack of stimulants in their body in order to drive these attention circuits. but how their development went completely influenced how they're able to pay attention today. We're running out of time in our summer series, but it's never too late to begin working on your child. Consider this information. And if you're ready to do something different, if you're ready to really work on the brain, you need to come to Connect My Brain. Feel free to call the office 678-501-5172. You can always reach us through the website, connectmybrain.com. And we want to have that chat with you. So you can always schedule a time to chat. Sometimes I got to really work at my schedule. Sometimes there's many things going on, but I promise you, I will connect with you. Thanks again to my podcast manager, Marcy Page, and my blog scribe, Natasha Brand. And we're bringing in a new one, which I will be announcing soon, who's going to help us get our information out on social media. I hope you have a wonderful day and be blessed.